Hi, good morning, everyone. Welcome to our Unit 1 discussion, your first week here in ST 120 for sterile processing. My name is Megan Ludwig. I am a CST. I also have my bachelor's degree. I've been a CST for since 2008. Okay, do the math there. I can't even do that math in my head anymore. But this is me. Sometimes it's helpful to put, names and faces together. These are my two little goobers, my two kids. Um, this is me working I also teach at my local community college, in-person classes. So this was us in lab one day, so, using our dummy. So a little bit, whoops, too far. A little bit more about me. I have been teaching Surg Tech for approximately 10 years. I scrubbed at our local hospital. Before that, I was on the ENT team, ear, nose, and throat. We also did a lot of eye cases. But I got to be pretty well-rounded in doing a lot of other cases, ortho, general, you name it, we did most of it. Because our ENT docs were done by like noon. So I got thrown into all the cases. I like doing things outside of ENT. I liked doing a lot of C-sections, open belly cases. Those were kind of my favorite. But so yeah, I've been in the Surg Tech for quite a while. And this picture right here, just so you know, this should be what you receive in the mail. I have already received some emails from some of you that you're still waiting on materials, and that's okay. Just do what you can with whatever you've got, especially the discussion. You don't really need your book for the discussion post, so go ahead and get working on that so you don't fall behind. But I'm not going to take off any like late points for something you don't have yet, so don't worry too much about that. All right, so today we're going to talk about we're going to go over our course objectives, and then we'll discuss some of the things from your chapter today. But today we're going to talk a lot about excuse me, equipment and different types of the ways the sterile processing department is laid out, how you go about that according to industry standards. And we're going to start the process of identifying those mechanisms for sterilizing instruments, just the basics, getting into it, and proper PPE. So we'll get into more of the details later, but every week I like to show you what you should expect for your homework. You can obviously look in Canvas and see weekly on your syllabus, but just to remind you, these are your points and your assignments due this week. This week is a little weird. We don't typically start on a Wednesday. So it is a kind of a shortened week, so make sure you stay up with that. So the discussion post, the first one, typically is due on a Wednesday, but this week it's due on Friday. So from next week on, it'll be Wednesday, and then your response post we do on Sundays. So make sure when you're doing these discussions, don't forget to come back and respond to your peers, because I'll take off points for that for sure. And also a lot of things I take off points for tend to be not just not responding to your peers, but not citing your sources in APA format. If you struggle with that or need help, let me know. There's also, I think, a link in your, forget where it is, it might be under the library tab or somewhere on the main page. You should be able to find a link to how to cite sources. If you can't find it, let me know. I can find it for you. No problem. All right, so how are your departments organized? So typically we refer to the sterile processing department as the central sterile department, or CS. Sometimes we abbreviate it central services. It has, like this last bullet point, it has quite a few names. Sterile processing is pretty common. Surgical supply, whatever your facility calls it. Ideally, it's going to be in a centralized location, because this department is responsible for re-sterilizing and supplying the rest of the hospital with the instruments that they need. So it's not just the OR, okay, that uses these instruments. It could be ER. Sometimes the OB department might do C-sections on their floor. So you're going to have things coming from a lot of places. So ideally, you'd want it centralized for that reason. Okay. Also, it's important to keep up with your education and standards. So once you graduate this program, you're going to hopefully sit for your certification exam, your sterile processing certification. But with those types of certification, you have to keep up your education with something called continuing education units. I have to do that as well as a surge tech to stay certified. So you want to keep up with that because, especially in the healthcare field, we sometimes find better ways to do things. We update our practices or come out with new products, um, better machinery, whatever it is. So that's very important. So what would you be doing as a sterile processing tech? I would assume maybe by now you have at least a good idea, right? But some of these things you don't often think about as being part of your job description. One of them is being a good team player, team member. You have to interact with not just people in your department, like the sterile processing tech working next to you. You also have to communicate with OR staff or like the OB department. Every department that would utilize your services, you have to communicate with them. If you are out of a particular item that you know the OR needs that particular day, you're going to contact them. So you have to have good communication skills. You also are going to be respectful of patients' rights. So you may not come in contact with a lot of patients in person, but you could. You always want to respect their right to their choices of medical care. And that goes with this word ethics, okay? Being respectful of that. Everybody has their own set of morals and beliefs. It is up to you to be mindful of that. So you may not always agree with what someone thinks or feels or believes, but in healthcare, you have to put that aside. The patient has the right to decide what they want to do. And then also this is a very big one, this last one here, are going to be responsible for understanding microbial transmission. We're going to get into briefly a little bit of micro, just so you can grasp the importance of making sure you take the steps necessary to sterilize these items. Because if you don't, you could lead to causing surgical site infections in patients, hospital-acquired infections, which could really be detrimental to the patient's healing, or honestly, it could kill them, okay? Some patients are very unhealthy, right? That's why they're in the hospital a lot of times. If you start introducing other bacteria to their system that just because you didn't clean the instrument correctly, it could, not to be dramatic, but it could end up killing that patient. So that is very important to put a high level of stress on understanding the microbiology behind it and the reasoning why we take such strict measures in sterilizing items. You're going to see this from IFUs pretty often. IFU stands for instructions for use. We'll refer to that quite often. Comes with each machinery, chemical, all have instructions for use. Sterile processing practices and procedures. So that's a good portion of what our entire quarter will be about. So to discuss the area that you're going to be working in, the sterile processing department typically has three main areas. You have a soiled or a dirty area. Then you have kind of in between, a clean processing area, and then a sterile storage area. So as you receive, that's why I put an arrow here, dirty items that have been used on patients, they go to the soiled area, right? They're going to be decontaminated here. Then they're going to be sent to this clean processing area. Usually it's like a washer decontaminator machine that goes between these two rooms, actually. So it gets put in here. It's going to come out the other side of that into a clean storage area that can be then reprocessed, wrapped, and then put into a sterilizer. So it's important to remember this first bullet point, keep clean and dirty items separate, always, no matter what you're doing. Because if you mix a dirty item with a clean one, now the clean one's dirty, right? So never send your soiled, dirty instruments to this side, the sterile storage area, because really you can mess some things up doing that. So it is a one-way flow. And this term decontamination, I should have mentioned this sooner, is removing those gross soiled items, like the bloody items that come from surgery, to make them safe for handling. That's what this clean processing area will do. Okay, so sterilization. A couple, you'll see some vocab terms throughout this. To sterilize something it means you're removing all living microorganisms, and here's the key word here, including spores. If you do not remove spores from an item, then they're still present. It is not sterile. Okay, there is no gray area with sterility. It's either sterile or it isn't. It's black and white. Super important to remember that. You can't say something is kind of sterile or it's sort of sterile. It isn't. If there is ever any question whether or not something is sterile, it's not. So in surgery, we say when in doubt, throw it out. If there's ever a question on something's sterility, it is not. All right. So typically in the sterile storage and distribution part is part of the sterile processing department. Part of this, you'll see this picture here, actually kind of both of them, is something called a case cart. So once the items have been sterilized, they usually go on a storage shelf, and for each case, they are going to be picked off the shelf for that particular surgery. The items needed for that surgery are then put on a case cart. Okay, so you in your department might have a computerized system that will print off what a particular surgeon needs for that particular surgery. And then you're going to go around your department and pick the trays, the instruments, the packs, whatever they are, according to what we call either a pick sheet or a preference card, preference sheet. So those are made up like by talking with the surgeon what they need. Usually when they first come to a hospital, they'll start one of these for them and update it as needed. Sometimes they decide they want new things for different cases, so they do change every now and then. All right, so let's talk a little bit about the processing cycle. So kind of going back to the workflow that we talked about before, you have these clean items that you've sterilized. Well, let me back up. We have these clean items going between the two rooms, okay, to render it clean, not necessarily sterile yet, sorry. You're going to inspect the items to make sure that they're safe for use. You always want to inspect every instrument you have before you reprocess it, reassemble or sterilize it. If you see like a scissor that has been used that's chipped on the end, maybe the end is broken off, you obviously wouldn't want to send that back up to surgery. The surgeon will not use it and probably get mad, right? Seen surgeons throw things for lesser reasons. It's not ideal, but it happens. Then they're going to reassemble it. Maybe they have a tray of instruments that it goes in, put it in the correct package based on the instrument type or whether it's an entire tray. Once it's packaged, it can then go in the proper sterilizer. So again, you may have to refer to instructions for use. Certain items have to be sterilized a certain way. It is not a one-size-fits-all for sterilizers. Some are better for things that can tolerate high temperature or moisture. Some cannot handle that moisture. It would ruin them. So be careful with how you sterilize your items. Once they're sterilized and they've gone through the sterilization process appropriately, they can then be stored on a shelf or in a, we call it a Pyxis machine. It's got like buttons and it keeps track. And then it, from your Pyxis machine or whatever, you could dispense it to be used. So that's the cycle you'll see every day with all these instruments or trays. It's important, like I said before, to remember ethics. So that definition, again, is to do something, the right thing when no one is looking. You're respecting people, no matter what you feel about the matter. It's important to have that level of respect, okay? Another important term here is standard precautions. This is a good definition, or like a vocab word. You're going to treat all patients and items like they have an infectious disease, okay? You can't see with your two eyeballs whether or not there is a deadly bacteria on this instrument because it's not always bloody, right? Some bacteria is spread through saliva. Can't always see that. So you want to be sure that you're treating all items like they are infected or dirty. So that means you're going to do things like wear gloves. You're going to wear your proper PPE. You are going to wash your hands constantly. So those are types of standard precautions. So I want to show you this quick little video about what it looks like in the sterile processing department. Maybe some of you have never actually stepped foot in one or seen one, so I just like this video, kind of gives you the lay of the land, so to speak.
One of the most important areas of Mary Greeley Medical Center is right here. We're in the sterile processing department, and it's where all the surgical instrumentation gets cleaned and sterilized for any upcoming surgeries. And not many people get to see this area, but I'm going to give you an inside look into the sterilization process. Each day, we see hundreds of different types of instruments that require hundreds of different ways to clean them, and each sterile processing tech must learn these to ensure that the instruments used are safe for the next patient. Instrument reprocessing begins in the decontamination room. This process begins by soaking and manually cleaning each instrument in a sink filled with a water and detergent mixture. This helps break down and remove the blood and other materials that can be left from surgery. We call this material bioburden. We use a variety of different types of brushes, syringes, and automated irrigators to remove the remaining bioburden from the instruments. After all the bioburden has been removed from the instruments, we rinse them and move them to the next step in the process, ultrasonic cleaning. With ultrasonic cleaning, we are removing the remaining biofilm that cannot be seen. Ultrasonic cleaning works by creating ultrasonic waves that travel through the water. These waves create tiny unstable bubbles, and when these bubbles come in contact with the instrument, they implode and remove the remaining biofilm. After all the biofilm has been removed, the instruments are rinsed and prepared for the final step of the decontamination process, mechanical cleaning. Mechanical cleaning is done in a washer disinfector similar to a high-powered dishwasher. This step removes anything that might be left on the instruments. The washer rack has spray arms that spin and clean the instruments using detergents and high-pressured spraying water. Each cycle provides a thermal disinfection so the instruments are safe to handle. When the cycle is complete, we can now inspect and assemble the instruments in preparation for sterilization. Assembly begins by inspecting each instrument to ensure that they are working appropriately. We then arrange these instruments into sets that will be used during specific types of surgical procedures. Each set has many types of instruments in common, as well as instruments that are unique to a specific surgical procedure. So each sterile processing tech is responsible for learning each instrument and how it works. This provides the surgical staff everything needed to provide excellent care for our patients. We then prepare the instrument set for sterilization by placing all the instruments in a mesh basket. The basket is then placed in a specialized container that is designed for sterilization. Some containers have a sealed hard outer casing, and some must be wrapped with a specialized material called blue wrap. Both types of containers are designed to allow the instruments to be sterilized in the container, and once sterilized, maintain the safety of the instruments while in storage. Sterilization is done by using different methods such as steam, vaporized hydrogen peroxide, and a variety of other methods, but the most common instruments that are used in a surgery are sterilized using steam. To make sure the sterilization process has been effective, we use chemical and biological indicators. Chemical indicators are placed on the outside of blue wrap or a rigid container and allow us to know at a glance that the instruments have gone through the sterilization process. They are also placed inside the container with the instruments so the surgical staff knows the instruments were sterilized and safe for use on our patients. The biological indicators help us verify that our sterilization process is effective enough to kill all the germs that may be on our instruments. This process helps us know we can provide patients with the best possible care. Once the instrument set has been sterilized, they go into our sterile storage area until they are needed for the next surgical procedure. This area is also the staging area for the next day's surgical procedures as well as potential emergency surgeries. Once the instruments are ready, we assemble them on a case cart to be sent out for surgery. Be sure to check out mgmc.org for more information.
There, so hopefully that showed you the 3 areas that I was talking about at the beginning, starting with decontam, that washer sterilizer or washer decontaminator, over to the clean reprocessing area. So I like that video. Hopefully that gives you a better idea of what that looks like if you haven't seen one. So just in conclusion, just remember that, as a sterile processing tech, you're going to be an integral part of this hospital. I always tell my students that sterile processing techs are like the heart of the OR. They're the heart of the whole hospital, honestly, because without sterile processing techs in this department, the rest of the hospital would literally crumble, okay? We wouldn't have clean, sterilized items. We wouldn't have supplies to go to each department. Really, your job is going to be so vital to patient outcomes. You don't really get to see that side of it where you are in direct patient contact, but such an important job to have good sterile processing techs. A sterile processing department can make or break a hospital for sure. So your job is going to be very important. So we talked about all of these. We're gonna talk more about, the knowledge of surgical procedures in a later video, just like how important it is to know your med term, your just some basic anatomy and how you can apply that to maybe what you need for those cases. Again, you're going to be working as a team, so if that's not something you're used to, that might take practice, right? Just being good at communicating and working together. It's not just you. Everybody has to work together for it to function efficiently, right? So just to remind you, you can find your due dates here in this calendar, or you could go to the syllabus and click on each of those things individually. But just remember to watch your due dates carefully. Don't get behind, all right? So especially with the discussion posts, other than this week, they're due initially on Wednesday with your responses on Sunday to 2 peers, to 2 people, all right? So watch those dates, write them out if you have to in a planner, whatever you have to do, okay? Because if you go 14 days in campus without any activity at all, it will automatically kick you out. There's nothing I can do about that. So don't fall behind, don't get kicked out, and don't just do one little thing a week and then, in week 8, try to make everything up. It's not going to work. It's not going to be efficient for you either. It's not going to make you a good sterile processing tech to just shove everything in at the end and hope for the best. So if you're serious about this, you need to put in the time and effort to do it right. So if you ever need help, though, please reach out to me. My email is here in Ludwig at herzing.edu. We could set up a Zoom meeting if you need to, but you can email me anytime. Okay. But yeah, additional office. If Tuesdays don't work for you, we can try to work something else out. But feel free to ask questions. I'll try to get back to you as soon as I possibly can. If you didn't think of one yet, I'm sure you will. All right. Have a great day. Bye.